You know that feeling, right? That dull, pulsing headache, perhaps some neck pain, or even that odd tingling in your hands?
Uh,
You might just dismiss it as, oh, a migraine, or maybe you slept wrong.
sure. Happens all the time.
But what if that uncomfortable sensation were actually uh, a subtle echo from tens of thousands of years ago, like a genetic link back to our Neanderthal ancestors?
It sounds pretty out there, doesn't it?
Mhm.
Yet that's precisely what some groundbreaking new research is suggesting.
Right.
Today we're taking a deep dive into Chiari malformation type I, or you'll hear us call it CMI.
CMI.
This is a condition where the lower part of your cerebellum, that crucial bit at the back of your skull handling balance and movement,
Mhm.
it actually droops.
Droops. Where does it droop?
It droops through the opening at the base of your skull. The technical term is the foramen magnum.
And I guess when it droops, that's not good. It creates pressure.
Exactly. Pressure and a whole spectrum of symptoms. So our mission in this deep dive is to explore this fascinating new research. It's drawing this, direct line between modern neurological problems like CMI and the actual shapes of ancient human skulls.
Specifically, Neanderthal skulls.
Specifically Neanderthals, yeah. We're pulling insights from a really recent study. It was a collaboration led by Kimberly Plomp from the University of the Philippines, Diliman,
Okay.
and she worked with neurosurgeon Ivans Barbosa Fernandez from Brazil's State University of Campinas. It's published in Evolution, Medicine, and Public Health.
And it's important because the root cause has been kind of murky, right? Even though doctors see it on MRIs.
Absolutely. Surgeons could identify CMI, no problem, from the scans.
Mhm.
But the deeper ultimate cause, that's been a real mystery. The study aims to bring some clarity.
Okay, so let's start right there. What exactly is CMI? Can you break it down for us?
Certainly. So at its most fundamental level, CMI is a structural issue. It's when those lower bits of the cerebellum, they're often called the cerebellar tonsils.
Tonsils, like in your throat.
No, different tonsils. These cerebellar tonsils extend, or you could say they herniate, through that foramen magnum opening into the spinal canal.
Okay. And what causes that herniation?
Well, the immediate, or let's say the proximate cause that clinicians see is an unusually small and flatter occipital bone.
And that's the bone right at the very back of your skull.
That's the one. The occipital bone is supposed to form this sort of bony cradle, perfectly shaped, to hold the cerebellum and keep it well clear of the spinal canal.
A cradle. I like that analogy.
But in folks with CMI, this cradle is, it's less developed, it's flatter, smaller. It effectively creates less space for the modern human brain, as Dr. Barbosa Fernandez neatly put it.
Less space. And that lack of space, I imagine, leads to some pretty significant symptoms. What do patients usually feel?
Oh, definitely. The classic symptom is often a headache, but one that really flares up when you do things like cough or strain, or sometimes even just laugh.
Wow, even laughing.
Yeah. Patients might also report chronic neck pain or maybe tingling sensations in their hands. And what's interesting is some cases can be completely silent for years.
Really? No symptoms at all?
None obvious until maybe later in life. So diagnosis can be quite variable. And because the cerebellum is so key for fine-tuning balance, speech, motor control, when it gets squeezed, it can really scramble those day-to-day skills.
Like what kind of skills?
Well, think about things like handwriting becoming difficult, or even just climbing a flight of stairs feeling unsteady.
And I've actually read that many patients say lying flat helps ease the pressure.
That's a very common report, yeah. It really points to gravity and that physical pressure playing a role.
So how common is this? You said diagnosis is variable.
Well, traditionally the figure was about 1 in 1,000 people, but more recent imaging studies are suggesting it might be way more common, possibly as high as 1 in every 100 Americans.
1 in 100, that's a huge difference.
It is. It suggests it might be significantly underdiagnosed, or maybe many cases are milder and don't get picked up unless you have an MRI for some other reason.
Okay, so we get the immediate cause, this small, flat occipital bone creating less space. But the ultimate why? Why is the bone shaped like that? That's been the real puzzle.
Precisely. For years, people proposed various other factors, things like fetal hydrocephaly.
That's water on the brain in babies, right?
Sort of, yeah, buildup of fluid. Or another condition called craniosynostosis, where the baby's skull bones fuse too early.
Okay.
People even looked at things like getting too much vitamin A during development. But none of these ideas really explained all the cases consistently. There was always a gap in understanding the true origins.
Right, that gap. And this is where Dr. Barbosa Fernandez comes in with his pretty radical hypothesis back in 2013.
Exactly. He looked at this puzzle and proposed something quite different. What if CMI is actually a consequence of interbreeding between early Homo sapiens, us, and other ancient Homo species?
Interbreeding, you mean like
Yeah.
Neanderthals?
Yes, primarily. His idea became known as the archaic Homo introgression hypothesis.
Introgression, meaning genes coming across.
Precisely. The idea is that people with CMI might carry specific introgressed genes, these ancient DNA sequences that slipped into the modern human gene pool from species like Homo erectus, Homo heidelbergensis, and crucially Homo neanderthalensis.
Okay.
And he theorized these particular genes influence how the skull develops, leading to this mismatch between our modern brain size and shape
Right.
and the shape of the skull, especially at the base of the cranium.
And we know this interbreeding actually happened, don't we? Just remind us quickly about that.
Oh, absolutely. It's very well established now through genetic studies. Most people today who have ancestry outside of Africa carry somewhere between 1% and 2% Neanderthal DNA.
A small amount, but clearly there.
A small but significant legacy from those interactions, yeah, probably around 50,000 years ago.
Yeah.
So, and if you look at Neanderthal skulls compared to ours,
Yeah.
the differences are pretty striking.
How
Well, their brains were actually a bit larger than ours on average. But the base of their skull, the cranial base, it sloped backward more. Someone described it like a built-in ramp.
a ramp. Okay.
This shape was probably really good for their Ice Age lifestyle, maybe supporting powerful jaw muscles for chewing tough food or allowing for bigger sinuses and cold air. But that shape seems to have left scant room for a bulging human cerebellum, as one researcher put it. Our modern human skulls tend to be more globular, more rounded at the back, the occiput. Neanderthals had lower, longer skulls, flatter foreheads, and a more angled occiput.
So a fundamentally different internal setup.
You could say that.
It makes sense then how that older blueprint could cause issues if you're trying to fit a modern, differently shaped brain into a skull that's partially built using those ancient instructions. Weren't there earlier studies hinting at this?
There were, yes. Some
Oh.
previous work did find correlations between having certain Neanderthal DNA variants and also having certain Neanderthal-like skull features, or maybe slightly less globular skulls overall in modern people.
So those studies kind of paved the way.
They definitely set the stage, yeah, which makes this new, more direct test by Plomp's team really compelling.
Okay, so let's get into that new study. With this whole archaic Homo introgression hypothesis as the backdrop, how did Kimberly Plomp's team actually test it scientifically?
They used some pretty advanced methods, specifically 3D data combined with something called geometric morphometrics, or GM.
Geometric morphometrics, what's that?
It's basically a way to analyze and compare complex shapes, like skulls, very precisely. Instead of just taking simple lengths or widths, it captures the overall 3D geometry, gives you a much richer picture of shape differences.
Okay, so more sophisticated than just using a ruler.
Much more.
Yeah.
So they created these digital 3D models from hospital CT scans. They had 46 skulls from people diagnosed with Chiari malformation, CMI, and 57 control skulls, so people without CMI. Then they compared the shapes of these modern human skulls to the shapes of 8 different fossil crania. These included Homo neanderthalensis, but also Homo erectus, Homo heidelbergensis, and some early Homo sapiens fossils.
A really comprehensive comparison. So what was the first step in their analysis?
First, they just focused on the modern humans, they asked. Are there significant, measurable differences in cranial shape between living people with CMI and those without it?
And we're there.
Yes. Big time. The analysis strongly confirmed that key assumption of the hypothesis. There are significant differences in the shapes of the crania of individuals with and without CMI, and these differences were especially clear in the base of cranium, the skull base.
Can you give some specifics? What was different about the CMI skulls?
Sure. They found that CMI skulls had a reduced height in the main dome of the skull, the cranial vault, and the back part, the occipital bone, was shorter and narrower.
Okay, consistent with that less space idea.
Exactly. And even specific landmarks, like that bump on the back of your head, the occipital protuberance, or another point called the asterion, they were positioned lower down on the skull.
Interesting.
Also, a point near the temple, the pterion, was further back. And that crucial hole at the bottom, the foramen magnum, was smaller and positioned more towards the front. All these little shifts add up to that restricted space at the base.
Wow. So that definitely nails down the anatomical difference in modern humans. But the really fascinating bit must be the next step, comparing them to the ancient fossils.
Right. This is where they wanted to see if the CMI skulls looked more like the archaic Homo species than the unaffected skulls did.
And what did they find? Did it match the original hypothesis?
Well, this is where it got really interesting and actually led them to refine the hypothesis. The results were a bit mixed, but in a very informative way.
How so?
The strongest link, by far, was with Neanderthals. The skull shapes of the CMI group matched Homo neanderthalensis almost point for point, as the study says.
Point for point. That sounds pretty definitive.
It's a strong statement, yes. The crania of living humans with CNI are demonstrably closer in shape to Neanderthals than are living humans without CMI.
Okay, so a direct hit on the Neanderthal part of the hypothesis. But the original idea included Homo erectus and Homo heidelbergensis too, right?
It did, and that's where the mismatch came in. Because interestingly, the unaffected living human skulls, the control group, were actually closer in shape to Homo erectus, Homo heidelbergensis, and the fossil Homo sapiens.
Oh, so the opposite of what that part of the hypothesis predicted.
Exactly. It contradicted the prediction that CMI skulls would resemble all three of those archaic groups. The resemblance was specifically and strongly to Neanderthals.
So the hypothesis itself had to evolve a bit.
Precisely. The conclusion was that the original archaic Homo introgression hypothesis was maybe a bit too broad. It should really be narrowed down to focus specifically on those introgressed genes from Neanderthals.
Makes sense.
So they've now started calling it the more specific Neanderthal introgression hypothesis. It fits the data better and gives a clearer target.
This really does highlight that classic idea of evolutionary trade-offs, doesn't it?
Absolutely.
I mean, a null shape that worked well for a Neanderthal, maybe supporting big jaw muscles, dealing with cold air, whatever it was optimized for, that same shape inadvertently creates problems when you put a modern, more globular human brain inside it, especially at that critical junction at the base of the skull.
You've nailed it. It's a perfect example. What might have been an anatomical advantage, or at least neutral, in one environment and lifestyle becomes a potential vulnerability in another context thousands of years later. These sort of evolutionary leftovers don't always just fade away quietly.
Especially when our lifestyles change so dramatically. An Ice Age hunter versus someone hunched over a screen all day, the demands are different.
Totally different.
Yeah.
What was adapted for one life can subtly influence our health in another.
Okay, so pulling all this together, what are the implications? What does this refined Neanderthal introgression hypothesis mean for people today and for how we might approach CMI in the future?
Well, I think the clinical potential here is really quite significant. If researchers can definitively pinpoint a specific set or sets of skull-shaping genes linked to this Neanderthal DNA, then clinicians could potentially screen families known to have a history of CMI, maybe identify individuals at higher risk before they even develop symptoms.
Wow, early detection. That would be huge, wouldn't it? Because the main treatment is surgery, right?
It is. Decompression surgery can be very effective, but it's a major operation. It involves removing parts of the skull bone, sometimes even fusing vertebrae to make more space and relieve that pressure.
So catching it early could mean what? Monitoring? Non-surgical approaches?
Potentially, yes. Closer monitoring, maybe physical therapy protocols or just lifestyle advice. It could perhaps delay the need for surgery or in some cases maybe even avoid it altogether if the symptoms are managed early. I imagine pediatric surgeons are watching this research very closely.
I bet they are. Could this lead to prenatal screening eventually?
That's definitely a long-term hope. If specific Neanderthal-linked gene variants are identified, maybe someday prenatal scans could flag a skull shape or angle that suggests higher risk, allowing for preparation and early intervention strategies right from birth.
That's incredible. And what about places without easy access to MRIs?
That's another interesting angle. Perhaps in areas with limited resources, a simple cranial X-ray measuring certain angles identified in this study might serve as a basic, accessible early warning sign. It could really broaden the reach of early detection.
Okay, so the potential is there. What are the next concrete steps for the researchers? Where do they go from here?
Well, the big one is genetic confirmation. The team plans to do full genome scans on Chiari patients, actively hunting for those specific sequences of archaic, likely Neanderthal DNA that might be involved.
Trying to find the actual genes responsible.
Exactly. And beyond just finding them, they hope to map the CT scan findings, the detailed skull shapes, onto the genetic data from hundreds of people. This could tell us if carrying specific Neanderthal skull DNA variants actually increases your odds of needing surgery for CMI.
So linking the genes not just to the condition, but to its severity.
Precisely. Another really key area is looking at global prevalence patterns.
How so?
Well, the Neanderthal introgression hypothesis makes a clear prediction. CMI should be significantly more common in populations outside of Africa, who generally carry more Neanderthal DNA compared to populations within Africa.
Ah, a testable prediction based on ancestry.
Right. Now, this needs much more research because CMI is almost certainly underdiagnosed in many parts of Africa due to issues with healthcare access and cost.
Yeah.
But it's a crucial prediction to investigate.
Makes sense. What else are they looking into?
A few other important questions, like when during development do these skull-shaped differences actually emerge? Is it prenatal, early childhood? Understanding the timing is key. They also want to get a clearer picture of that brain-case relationship. So directly comparing 3D models of the brains themselves with the 3D models of the skull interiors in CMI patients. That could really show how the mismatch physically happens.
Seeing exactly how the brain is fitting or not fitting.
Exactly. And finally, they're acknowledging that, look, these introgress genes probably explain some cases, maybe many, but likely not all cases of CMI.
Right, biology is rarely that simple.
So they also need to investigate how those other proposed causes, like the hydrocephaly or craniosynostosis we mentioned earlier, might interact or correlate with these specific cranial shape differences. It needs a holistic view.
It really sounds like this study, while providing some fascinating answers, has also opened up a whole new set of questions. But the method itself seems really powerful.
Oh, absolutely. Using 3D geometric morphometrics here is a big step forward. It's one of the first times it's been applied so effectively to CMI and cranial shape. And it's already added several previously unrecognized skull traits to the list associated with CMI.
Which could help diagnosis down the line.
Definitely. It strengthens the diagnostic potential and might eventually inform treatment strategies, too. It's just a fantastic example of how studying our deep evolutionary past, looking at fossils and ancient DNA, can have direct relevance for modern medicine today.
So there you have it. It's pretty mind-bending to think about, isn't it? That next time you feel that familiar headache or that neck twinge, it might not just be stress or bad posture. It could just possibly be a faint echo of interactions that happened between our ancestors and Neanderthals tens of thousands of years ago, literally shaping your skull and how well your brain fits inside it today.
This deep dive really does underscore just how interconnected our present health can be with our ancient past. It's such a powerful reminder that evolution isn't just something that happened long ago. It's this ongoing story of adaptations and sometimes trade-offs. What worked wonders for survival back then might create subtle challenges for us now in our very different world.
It definitely makes you wonder, doesn't it? What other evolutionary leftovers might still be hiding inside us, quietly influencing our health and well-being in ways we haven't even begun to understand yet?